Hello, everyone, and welcome to today's stream. Today is an interesting topic. We're going to be talking about MST and how one can work with the VBA for benefits related to MST. But before we begin, I want to remind you all to like and follow and subscribe. Also, if you want to ask a question or make a comment, we can see them from wherever you're watching, Facebook, YouTube, or Instagram. So just put it in the comment section and we'll be able to see and answer your questions. So I'd like to welcome Dr. Christine Kalmes and Dana Dupree Kohler, who are going to be joining us today and speaking about MST and benefits. Welcome, Dr. Kalmes and Dana. Thank you for joining us today.
Thank you.
Thank you so much for having us. So, as Rosalia mentioned, my name is Dr. Christine Kalmes. I am the Military Sexual Trauma Coordinator for VA Maryland Healthcare System. In honor of Sexual Assault Awareness and Prevention Month, which is the month of April, we are so excited to have Dana Dupree Kohler here to answer questions about applying for benefits related to military sexual trauma. I want to take just a moment to introduce Dana, and then we'll get started with some basic questions that I'll ask. If you have questions throughout this, please do type them in the chat, and we will get to them after Dana provides some basic information. So Dana Dupree Kohler is a U.S. Army veteran who moved to the DMV area from Louisiana in September of 2018. She began a job search within the federal government after receiving her Bachelor's of Healthcare Administration from Purdue University. She was hired at the Baltimore VA in June of 2019 as the My Healthy Vet Coordinator, where she served until December of 2021. Then she moved to the Baltimore Regional Office, where she began as a veteran service representative, processing claims for veterans and doing outreach in the community, along with working directly with public contact within the Baltimore Regional Office. She became one of the MST coordinators for VBA. She also did Veterans Treatment Court, where she assisted veterans with legal needs and helped them complete claims and get their benefits. She's transitioned to vocational rehabilitation specialist within the Baltimore Regional Office. As a veteran, she has a profound love for what she does and is excited to be here learning everything that she can to be a well-rounded source of information for fellow veterans and those who assist veterans. Again, I am thrilled to have Dana joining us today. My first question for you, Dana, is as a veteran who has experienced MST, what types of benefits would they be eligible for?
When it comes to veterans who have experienced MST, a lot of their benefits would be them mostly in the realm of they would receive, of course, tax-free disability every month, depending on their rating, because the rating can go from 0 to 100%. Other benefits would be for them to have, if they get 100%, They'll be able to have tax exempt for their home. They'll have indefinite tags for their cars. Their dependents can file for Chapter 35 dependency benefits for education. They're also open to many other things, such as voc rehab, what I do with education, and that can go through many different avenues for them. It's not just what it says, vocational education. It also helps with independent living. Um, as I told Miss Christine earlier this week, I was excited about it. I was like, I did not know this program assists with childcare now. So there's a stipend for childcare. They also assist with homelessness and other things. But when it comes to MST and filing, you're open up to so many different benefits, and also health wise, being able to go to the VA hospital and receive your treatments and get your mental health and stuff like that. So many avenues that are open to you that you should definitely take advantage of.
Great. Since MST is not a diagnosis, but rather something that the person experienced, what types of diagnoses do people apply for related to service connection?
So, in relation to that, a lot of people apply for a PTSD, major depressive disorder, bipolar disorder. There's anxiety, depression. There's many different avenues to obtaining your MST, because not everybody experiences it in the same way. Some people, experience it in different ways. It might cause a heightened anxiety or depression. It could cause, PTSD, and it could cause major depressive disorder. It just depends upon that individual and how, a trained professional in psychology or psychiatry looks at it according to the DSM-V5 and says, hey, this is what it's under. This is what your MST has caused, and so it's looked at it like that. A lot of people have alcohol and substance abuse issues related to their MST. So it just is really something that's looked at on an individual basis and according to when you speak with your mental health provider.
Excellent. I have a lot of veterans ask me how they even get started applying.
So you have two avenues. You can go through a VSO, which is a veteran service organization, and they are the DAV, Disabled Veterans of America. There's American Legion. There's the VFW. There's Paralyzed Veterans of America. So many different VSOs that's out there. Those are just a few of them. Or you can visit your local regional office where you can speak with a legal administrative specialist, where they can sit down with you and they can look into your file and say, okay, well, this is what's going on. And what they'll do, if it's your first time filing, they'll do what's called a 21-526. And they'll take down any medical evidence that you're filing for associated with the MST. One thing that you will get asked, and this is very important, do you have a diagnosis? Do you have a current diagnosis? Are you currently seeing your provider? Have you been seeing that provider for 3 to 6 months or more? When it comes to your diagnosis, have you started treatment? Or because some people will start and then they'll stop. So we look for things like that. We also look for, when filing, if you have anybody like with buddy statements that can write a statement for you, where things have changed, where things might have changed in your personality, in your habits. You've become more withdrawn, or you're not the same person that you used to be. You might be angrier, or there's other things that's going on, depression, you're withdrawn from work and family, you can't hold functional relationships, things like that. We also do what's called a 21-0781, where we do an intake of Have you started, with substance abuse or alcohol? Have you, did you ask for a change in your duty station, or your unit while you were still in the military? Did you change the way you hung out with friends, or the way you carried yourself? Your hygiene changed. You stopped presenting yourself in the way that you used to, which was all neat and clean and well put together. Your tone of voice changed. The way you were in certain areas, you became more jumpy, or um aware of certain things. So we look for those things. Also, if you filed a police report, or if you went to a mental health counselor while in the service, or just to maybe your local chaplain or something like that. We look for those things. But if you don't have them, and you have family members or friends that notice the changes within you, then we will take what we call lay statements from them, to go in your file.
Great. So, do I have to have a diagnosis from the VA or receive treatment from the VA in order to file?
You don't have to exactly receive treatment from the VA. You can actually go to a private doctor. If you go to a private physician, you can we will get those records. We fill out what's called a 21-4142, 4142A, and we request those records from your private provider. I see somebody, Jealous Sykes. I just want to address it because I don't want, him to feel like we're not um talking towards males as well. So when it comes to males, of course, those things that we look at, we'll look to see if the same rules apply. You went to the hospital, to get treatment, that you talked with someone. Also, if there was any STDs that happened or anything like that, not like females, we ask, if you became pregnant, did you have the baby, or, what happened. So same rules are kind of apply for both. The only difference is with women, we ask if they're pregnant, but always ask if you went to the hospital, if you spoke with someone, if there was any STDs, did you have a sexually transmitted disease test done during that time. And so if you did, then we corroborate those times, and we look for the unit you were in. You tell us what unit you were in and stuff like that, and we go based off of what you told us, so that we can start to put the pieces to a puzzle together, especially if you did not report it to your higher chain of command, or get any assistance with it.
So, you were saying you don't have to go to the VA for a diagnosis or
No.
treatment. You can submit records from a private doctor, or if you go to the vet center, you can
Yes,
even
ma'am.
submit those
Yes,
records.
ma'am. It just makes it, for us, it makes it easier if you go to the VA, because we have access to their records. And so we can pull them over real quick, as opposed to waiting for, a private doctor or a vet center to turn anything in to us, because sometimes we give them 30 days, and sometimes they take longer than those 30 days. And then we have to send you a letter asking, could you please submit the documentation. Your doctor isn't replying, and stuff like that. So it makes it easier if they do go to the VA hospital. That's all.
I have a
Okay.
question. How long does it take for someone to, after they file a claim, to hear some kind of response? How long does that take?
So once we receive the claim itself, within 30 days they'll get what we call a subsequent development letter. And on that letter they will say, if you have any further information, please turn it in. We're working on your claim, um and stuff like that. But roughly, just depending on how much information is needed for that claim, because they do what's called an MST incident report. They also do a MST checklist, and then you have to get the CMP exam, which is the compensation and pension exam, where you will meet with a healthcare provider, a mental health care provider. that the VA sends you to, unless there's a caveat to that, because you can also get with your mental health provider and do what's called a disability benefits questionnaire, a DBQ, and your provider can fill it out and do a medical opinion, which will then put you in a position to have it pushed through a little bit faster than those who take the traditional route of having us to find someone for you to see and sit and talk with about the MST and any other issues that you might have added to it. So roughly, I would say 6 months to a year, but it just depends on caseloads, and if it goes to San Juan, Puerto Rico, or if it goes to Virginia. Oh my God. Okay. Is it possible for us to find out who this veteran is and I can reach out to them directly, please?
I can provide you with his contact information. I have it from
Okay.
here. So I'll do that, and I'll do that after the stream is done.
Okay.
Next question was, will the veteran have to talk about the event to apply?
We so on that 21-0781, there are specific questions that we do ask. We ask for the unit, we ask where it happened, when it happened, and we only ask for a small description of what it was that did happen. Because we're going to get records from your provider, whether it be VA or a private provider, all of that will already be in there. So that's something that they will, definitely look at. We try not to ask too much, but if that veteran is willing to sit and share with us, we do type it up on a 4138 for them to also have that information for the provider that they'll be seeing. Because I know sometimes it's very uncomfortable to sit down and talk with someone about it and then have to go and talk to somebody else that you don't know about it, and it's just constantly opening up the same wounds. So if that veteran is willing to sit and open up with us, then yes, we will take all information that they're given and type it up for them. That way it's already in the file.
Will they have to talk about it during the comp and pen exam?
Yes, they will ask them specific questions. For the most part, for the compensation and pension, they try to take as much as they can out of the file to answer the questions, but they will kind of like reiterate and say, hey, when did this happen and how it happened, to, I guess it's mostly to see, exactly how that veteran responds, doing this, because that's taken into consideration, as well. But again, to not have somebody go through that, I always tell them you have the option of getting your mental health care provider to fill out that DBQ. And that way we don't have to, go through the process of having them go through that again.
Mm-hmm. My next question is, what if my claim gets rejected?
I don't like talking about that part, but that is something that happens. And if the claim does get rejected, we always send a complete narrative of why that claim was rejected. You will know exactly why. It could be from maybe you went to a private provider and that provider did not give us the information. We reached out to you to get the information. You didn't turn it in. It could be that they didn't have enough information from what you did tell them to go on for them to find the unit and, anything that could have related to that. It could also be that you didn't have a diagnosis. And so that's why I say it's very important. The first question is, do you have a current diagnosis? When was the last time you seen your mental health provider and talked about this? Because a lot of people go to their mental health providers, but they never talk about this issue. And so when we look through the records, we see things that say I went through this in my marriage, or I went through this, as a child. And so now we're taking, this provider who's never seen you, this is their first time seeing you, they're looking at that and they're like, well, this wasn't related to service. This is related to an event from them being married, or an event from when they were a child. So it's very important to make sure you speak with your mental health provider about your MST and how it's disrupted your life, and any other issues you might be having when it comes to that, to keep your claim from being denied, because we look at everything.
What if I get a rating, but I feel like it's too low?
So if you get a rating and you feel like it's too low, again, in that narrative, we do tell you exactly why we gave you, say, 20% or 30% rating, and why we didn't give you the higher rating. So everything has cause and effect, I'll say. You might get 20 or 30% because maybe you just have depression, and you're withdrawn. But when you get to like 50, 60, 70, 90, 100%, that's saying that you're constantly having, maybe suicidal ideations, you're not taking complete care of yourself and stuff like that. And so when you get a rating that you don't feel is just and fair, think about what you told your counselor, then when we pulled your records and what we're looking at. And also, if you don't agree, you can always come back with new and relevant evidence to us, and we will definitely take a look at it and give you another CMP exam if we feel that's necessary. Or we'll just look at the notes from your counselor and say, okay, yes, this rating was not fair, and go from there. If some people don't want to come back to the regional office and do it, so they do what's called a higher level review, where they can speak with a DRO officer, and you can request to speak with them. They will give you a call, and you can say, hey, I don't feel like this was fair. This is what I'm going through. I explained this to them and they still gave me this rating. And that DRO officer can choose to order another exam, or just take what you said and go from there, and make a decision on the rating.
Mhm. If I start the claims process, can I stop? Do I have to complete it?
No, you can definitely stop the claims process. We have a lot of people that come in and they'll start it, and they'll definitely stop it because they don't want it to be in their file that, they don't want family members to know. They don't want their children to know, or their spouses, or, their mates to know what they went through. So they'll call and they'll say, I want to stop it. In order to stop that process, you have to fill out a 21-4138, which is a statement in support of claim. And upon stopping that, you'll tell us, I don't want to follow through with the MST claim. Can you please retract everything, and we'll close that claim immediately.
Mhm. Okay. Are there any common mistakes that are made that folks should watch out for?
A lot of the common mistakes that are made comes in where you don't provide enough evidence, or you might let's see, I have a list of them, so I'll pull them up, so that way you'll have four more steps into a lot of the mistakes that um people make. But a lot of the common mistakes are, they don't file the claim properly, or they don't give enough information. um they'll feel guilty about, what happened with it. um and the biggest thing, like you just asked, they'll have failure to appeal the decision because it was denied. Don't do that, please. I implore y'all, don't. Please, by all means, this happened, let's get it seen about, and make sure that you talk to your counselors in depth about it, so that they can document everything. And make sure that when you talk to either a VSO or a LAS at the regional office, as I stated earlier, that you tell them everything you can possibly think of telling them. Um, there are also secondary issues that you can put in, and those are some of the common mistakes as well, that people only think that just the PTSD or the major depressive disorder, but other things can happen. You can have chronic pain in your body.
Hmm.
Some people even experience what they call PEENS, which are psychogenic seizures,
Yeah.
because they can't adapt to what happened, and so their body goes into a psychosis where they literally have seizures. So it's very, very important to address these issues, and don't feel like you can't talk about it.
Hmm. Absolutely. Any questions for Dana before we wrap up?
There's another comment. I'm currently leaving therapy. Can you see it?
Yeah, I
I
can see it. It
can.
says, I'm currently leaving therapy and have been in therapy for 3 years now. I do thank my higher power for Pete Alman. It's such a struggle without a full range of the services offered. Um, I would say please don't leave therapy. I have a very personal attachment to MST and PTSD for my fellow veterans. And I'm gonna just say, please, please, please stay in therapy. There are many, many services that are open to you. I will reach out to you myself and talk to you about those things, off camera. But please don't give up on therapy. If you feel like your therapist is not doing what they need to assist you, and you're being seen at a VA facility, you do have the choice to ask for a community care provider, to go out into the community to get the assistance that you need. But just know that there's many, many services that you can do. You don't have to. You can do cognitive therapy. You can see a social worker. There's many, many different avenues. A psychiatrist is not your last stop. I promise you can see a psychologist. So there's a lot there
Hmm.
that can assist you. So don't leave therapy. Just maybe leave who your therapist is. I am not a clinical therapist myself. Dr. Combs is, but I can just tell you from you know where my heart is. Don't leave therapy. And I'll give you a call. I'll reach out to you as soon as.
Yeah, and so actually, I think this user was logged on
Yeah,
with
to
his niece's
his niece.
account.
Right.
So why don't we give him your number so
Okay,
that he
yeah.
can call you, Dana?
So I don't know it by heart, but I'm gonna give it to you. I got it. So my work cell phone number is 443-794-0389. And you can give me a call or send me a text message letting me know who you are and that you are on a Facebook Live, and I can definitely give you a call and talk to you about the options, and let's see what we can do to get you going. I
And
would be more than happy to do that.
if you need assistance connecting with mental health treatment through the VA, I want to remind you that all mental health treatment related to military sexual trauma is provided free of charge through the VA. And please call me at 410 if you need to be connected with mental health services.
Can you write that? Can you say that number again so I can get it into the?
Yes, it is 410-350-5464. This has been a great session. I hope everybody has some basic information about how to apply. And you certainly have contacts with Dana or myself to ask more specific questions about the process and get connected with mental health treatment.
Yes, we would we're here to assist in every way possible. Please don't feel like, you don't have someone that you can come to for that assistance. I might not be in a capacity of being, a counselor or someone in that capacity, but I have been in and out this all over within the VA. Now I'm in the education department where I can, in that department, like I said, there's many facets. So we also assist with counseling in those areas as well. And also, like I said, independent living to get you things that you might need so that you can, live a productive and successful life, even with, going through your mental health issues and stuff like that, too, is where you can feel comfortable in an environment. So please, y'all, just take advantage of this Facebook and Instagram live, and we provided our phone numbers. Please reach out if y'all need to. Miss Rosalia, if they I don't have Facebook, so if they like comment or send you anything, you can always ping me and let me know, and that way I can reach
Sure.
out to them.
That's no problem. And when I get off the screen, when we get off the stream, I will send you this veteran's number. I do not have his last four. But I can
I
reach out.
do.
Oh, you
I
do?
do.
Okay.
And
Okay.
I'll send you an encrypted email message with
Okay.
his information so you can contact him.
Okay. All right. So you'll send it to Dana?
Yes, I will.
All right. All right. Well, I'm so happy that we were able to get this information out there. Veterans, you heard it here. If you are struggling with MST and either are not treated or do not know that you can actually apply for benefits as a result of your experience of MST, you heard the tea. We spilled the tea here. So now's the time to. Today's the first day of the rest of your life. So now this is the time that you can actually start your journey to wellness. Thank you all for showing up and for listening in. Whoever gave us the like, thank you so much for the like. We appreciate it. And we will talk to you soon in our next stream. Thank you very much. Bye now.